I might just send it.
So all this is here, we use shares in addition to on the right here. I just want to feel our very bound. Can we go through the panel of this? General expert. Oh, we have pictures. Quadrangle. So this is all what you do. You know, this will I'll start reading. So do letters that way, wouldn't be that way, and then after that one, really what way. Then now that you stop waiting. So ultrasound, we call it waiting area. And then that's The reason we put that there is that you can now have women coming segregated for specific days of the week. So it's either you're going for ultrasound or you're going for mammography. That's then on the top there. Do we have this thing? Yes. Just now you get I've been on forever.
Where's the sketch for this?
Yeah, we've seen. Now upstairs. Latest one. Ramp is here.
The ramp is over here.
On both sides. 8 offices so that we can take the rest of the staff from radio diagnostics. Then on this side of this wing, you basically have the integrated laboratory. So you have your chemistry, your immunology, and hematology. Originally, we had planned this for microbiology, but because requirements and because it's a dirty thing, it won't happen here. We just have this as preparation. That goes to the other place.
In that case, are you going to publish that?
Hello, good morning. This is Mike. Okay, I'm in the meeting right now. Can you call me back?
Well, that's the project director for the project.
This project, when do we see the completion? For how long is it going to take?
Well, one of the things that the present government has been trying to achieve is the complete redevelopment of the Lagos State University Teaching Hospital and the College of Medicine. And there has, since last year, been an integrated project to improve the level of healthcare for the citizens of Lagos State. All the projects you see ongoing, which we have inspected today, are all due for completion before middle of April.
Middle of April. Can you mention all these projects? What are they?
Well, the whole project started with the rehabilitation of the various wards. If you understand, this is an old general hospital that's been converted to a teaching hospital, and therefore the demands for the level of care is much more than that of a general hospital. So what the government has done is to basically rehabilitate all the existing wards, rehabilitate the emergency center, which is LASEMS, rehabilitate the medical casualty, rehabilitate all the outpatient departments. They have also increased the number of theaters from 2 to 5 with an integrated theater complex. They've also recreated a dental school which will take care of the training of dental doctors and students. They've also done the new development that you're seeing are 3 key developments which basically completes the ongoing rehabilitation. The first one you have here is the Radio Diagnostic Center, which basically has all the latest in terms of CT scan, MRI, general X-ray, fluoroscopy, and then mammography for screening of breasts, because cancer of the breast is very common this day and age, and then ultrasonography. It also will have facilities for teaching, because the most important thing is to be able to keep on training students to become doctors and to train doctors to become specialists. So that's the whole concept here. That's why it's an integrated project between the college and the teaching hospital. The other 2 facilities that you see here, the one behind me, is the clinics, 5 clinics for pediatrics and 5 clinics for family medicine, and we also will have an ICU for pediatrics and also wards for pediatrics. So it's going to be like a children's complex. On the other side, which we inspected earlier, we have central wards to be able to increase the bed capacity within the hospital because of the amount of redevelopment that is going on. Because by the time your radio diagnostic center starts working, you're going to have more patients, as we can see already, even with LASEMS, after it's been rehabilitated, from the level of patients, the type of patients that are coming, and the numbers, sheer numbers that keep coming in each day, you can see that there's a need to have more bed space within the facility. We're also having more and more students who are coming in for training as doctors, and also more and more postgraduate facilities which are being created to train more specialties in the different specialties of medicine, whether you have surgery, pediatrics, ONG, medicine, orthopedics, what have you.
It's about as a project coordinator, how much do you think it will cost the state government to get all those?
I can assure you that the state government has invested a lot of money to be able, because medicine is a very expensive business. To take care of the health of people, it costs a lot of money. It is one of the few businesses that is very top heavy, because you have specialists at the top of the profession to give services.
All right.
But we don't want to put it because of the dirt. So Tabasba do bread, Tabasba in the second coating, that's what we can fix them now when they come. Hey, no putting in the
Temporary.
Where do we start?
I can't. That was the other day. So I said,
would you like to tell us how much has been committed to this conversion project and rehabilitation, building of new structures for the hospital?
I can tell you that a lot of money has been expended so far on all these rehabilitation activities. For the secondary care facilities alone, we spent almost $1 billion for the various facilities. You know, we have about 6 of them that are ongoing right now. And like we are telling the contractor, these 6 must be functional before the end of this administration. Are we confirming that? For Ikeja alone, like you saw in Ikeja, so far we've spent almost over 4-5 billion, and it's an ongoing process. Those things have been done in stages, and the idea is, one, to provide service to the people, access to healthcare, and secondly, for Ikeja, to raise the standard of care to what is comparable to what a tertiary institution should be, a teaching hospital should be. We're trying to kill so many birds with one stone. One, we are raising the standard of care. 2, we are moving up with modern trends. 3, we are giving a conducive environment to the workers who work there. Number 4, we want to improve quality of care. For Ikeja too, it's going to serve as a training institution for medical students and even specialist doctors, residents. And of course, the third function of a tertiary institution is research. They must have a conducive environment to be able to conduct their research. That way, people you normally send abroad, you won't need to spend so much money to send them abroad again by the time that place is completed.
What is your reaction? How are you impressed by what you have seen so far?
Well, I am impressed partially, but what I've seen, at least they're going to make amends now. Within the next 1 week, we'll see better service. A lot of the facilities are almost completed. They just have to be put into use. Like they are giving instructions for what and what to do. There's no point in spending so much money here, not utilizing it effectively. We have to get the maximum out of them. So in the next 2 weeks, we'll see a major change here. A major change. The theaters will be functioning, the wards will be functioning. The laboratory will be completed as soon as possible. This is almost ready for full secondary care service.
So what is the percentage of completion? Can you rate it?
What I've seen here is over 80% completed. What we saw in Mushin is over 85% completed, just minor adjustments. Next week we are going to go to Akodo, Bejuleki. Then we go to Alimosho. Alimosho we are handling very soon. We are going to first tackle that too, because the contractor we've discussed with him. We need to complete that too. The next 2 to 3 months, all the 6 hospitals will be fully functional.
And why is the state government embarking on this project?
One, it's the promise of this by this administration to put secondary care facilities in at least each ward. These 6 were part of the 8 that did not have any secondary care facilities at all. That's number 1. So we are in excellent fulfilling the promise. 2, we are providing access to the people to healthcare. But those areas before that they were congested in other hospitals that had. And that's why they have excess workload on the staff who work there. Now the people don't have to walk so far away to access healthcare. That's number 1. That is the essence of providing this. 2, the teaching hospital, we are going to reduce the pressure on it so that teaching hospital is able to do